Menopause is a natural part of a woman's life. It marks the end of her menstrual cycles. This transition usually happens between the ages of 45 and 55. It is officially diagnosed after you have gone 12 months without a period. However, the time leading up to this, called perimenopause, can last for several years. During this phase, your hormone levels, especially estrogen, begin to fluctuate and decline. This hormonal shift is the root cause of the many symptoms that women can experience. Understanding this process is the first step towards managing your health effectively during this significant life stage. The symptoms of menopause can be wide-ranging and affect every woman differently. Many people are familiar with hot flushes and night sweats, which are medically known as vasomotor symptoms. These can be very disruptive, affecting sleep and daily comfort, but the symptoms go far beyond just feeling hot. Many women also experience mood changes, such as increased anxiety, irritability, or feelings of low mood. Brain fog and difficulty with memory or concentration are also very common. These cognitive symptoms can be particularly distressing, making women feel unlike themselves and impacting their confidence at work and at home. Physical symptoms can also be a significant challenge. You might notice changes in your skin, with it becoming drier and less elastic. Your hair might become thinner as well. Many women report joint aches and pains, which can often be mistaken for arthritis. Vaginal dryness, itching, and discomfort during intercourse are also very common due to the lack of estrogen. This can lead to a decline in libido and affect intimate relationships. Furthermore, women often experience recurrent urinary tract infections or an urgent need to urinate. These symptoms combined can have a profound effect on your overall quality of life. The impact of these symptoms should not be underestimated. They can affect your work, your relationships, and your general sense of well-being. Poor sleep caused by night sweats can lead to daytime fatigue, making it hard to function. The emotional toll of anxiety and low mood can be isolating. Many women feel they have to just get on with it, but these symptoms are real and treatable. It is important to recognize that menopause is not just a few hot flushes. It is a significant health event caused by a hormone deficiency. Seeking information and support is crucial for navigating this time and maintaining your health for the future. Menopausal hormone therapy, often called MHT, is the most effective treatment available for menopausal symptoms. It works by replacing the hormones that your body is no longer producing, primarily estrogen. By restoring your hormone levels, MHT can directly address the root cause of your symptoms. This is why it is so successful at providing relief. For most women, the estrogen is given as a gel, patch, or spray that is absorbed through the skin. This is known as transdermal estrogen. Many women will also need to take a separate progesterone or progestogen to protect the lining of the womb unless they have had a hysterectomy. The primary benefit of MHT is the significant reduction in vasomotor symptoms. Hot flushes and night sweats can often diminish or disappear completely within a few weeks of starting treatment. This leads to vastly improved sleep quality, which has a wonderful knock-on effect on your energy levels, mood, and cognitive function during the day. Imagine waking up feeling refreshed instead of exhausted and drenched in sweat. This relief can be life-changing, allowing you to regain control and feel more comfortable in your own skin. It gives you back the energy to enjoy your life to the fullest. Beyond hot flushes, MHT offers a wide range of other health benefits. It can significantly improve mood-related symptoms like anxiety, low mood, and irritability. Many women find their brain fog lifts and their concentration improves. MHT is also excellent for treating genitourinary symptoms of menopause, such as vaginal dryness and recurrent urinary tract infections, which improves sexual health and comfort. Furthermore, by replacing estrogen, MHT helps to protect your bones. It reduces the risk of osteoporosis and fractures in the future, which is a major long-term health benefit for postmenopausal women. The best candidates for MHT are generally healthy women who are under the age of 60 or within 10 years of their last menstrual period. For this group, the benefits of starting MHT usually far outweigh any potential risks. Before starting any treatment, your healthcare provider will conduct a thorough assessment of your personal and family medical history. This is to ensure that MHT is a safe and appropriate choice for you. It is not suitable for women with a history of certain cancers, such as breast cancer, or those with a history of blood clots. A detailed discussion will help you understand your individual situation. One of the most persistent myths about MHT is that it causes significant weight gain. Many women notice they gain weight during perimenopause and menopause, and they often blame the treatment. However, scientific studies have shown that MHT is not the cause. The weight gain experienced during this time is actually related to the hormonal changes of menopause itself and the natural process of aging, which can slow down your metabolism. In fact, some women find that by improving their energy levels and mood, MHT makes it easier for them to exercise and maintain a healthy lifestyle, which can help with weight management. Another major concern for many women is the risk of heart disease. Old research from a large study called the Women's Health Initiative, or WRI, initially suggested a link. However, this study involved older women, many of whom were well past menopause and were using older types of MHT. More recent analysis and newer studies have shown a different picture. For women who start MHT under the age of 60 or within 10 years of menopause, the treatment does not increase the risk of heart disease. In fact, for this group, taking estrogen may even have a protective effect on the heart. The fear of stroke and blood clots, known as venous thromboembolism or VTEL, also stops many women from considering MHT. The risk is indeed linked to the type of MHT used. Oral estrogen, taken as a tablet, is associated with a small increased risk of clots and stroke. However, this risk is very low for younger, healthy women. More importantly, when estrogen is delivered through the skin via a patch, gel, or spray, there is no increased risk of blood clots. This is why transdermal MHT is the preferred and safest option for most women, effectively removing this concern. Perhaps the biggest myth of all is surrounding breast cancer. The WHI study created widespread fear, but the data needs to be understood correctly. The slightly increased risk of breast cancer was seen in women taking a combination of older types of estrogen and synthetic progestogen. The risk associated with modern body-identical MHT using micronized progesterone is thought to be much lower, or even negligible, especially in the first 5 years of use. To put it in perspective, the risk is lower than the increased risk associated with drinking 2 units of alcohol a day or being overweight. It is a small piece of a much larger picture. While MHT is very safe for most women, it is important to be aware of the potential risks, even if they are small. There is a small increased risk of gallbladder disease for women taking oral estrogen. This risk is not seen with transdermal estrogen. For women who have certain pre-existing conditions, such as systemic lupus, erythematosus, or endometriosis, MHT might cause a flare-up of symptoms, so it needs to be managed carefully with a specialist. It is all about weighing the individual benefits against these potential risks, which for the majority of symptomatic women tilt heavily in favor of treatment. The benefits of taking MHT often extend far beyond just symptom relief. By improving sleep, mood, and energy, it can lead to a dramatic improvement in your overall quality of life. This allows you to continue thriving at work, in your relationships, and in your personal pursuits. The long-term protective effects on your bone and heart health are also incredibly important. Estrogen is vital for keeping your bones strong, and MHT is proven to reduce the risk of fractures. It can also lower your risk of developing type 2 diabetes and may even reduce the risk of bowel cancer and dementia. Ultimately, deciding whether to take MHT is a personal choice. It is not about what is right for your friend or sister, but what is right for you. The goal should be to make an informed decision based on accurate, up-to-date information and a clear understanding of your own health and symptoms. Do not let outdated headlines or myths from 2 decades ago dictate your health choices today. Modern MHT is different, and our understanding of it has evolved significantly. It is a safe and effective treatment that can help you manage your menopause and protect your future health. The most important step you can take is to have an open and honest conversation with a healthcare provider who is knowledgeable about menopause. Discuss your symptoms, your concerns, and your medical history in detail. Ask questions about the different types of MHT, the benefits, and the risks as they apply to you personally. Together, you can create a treatment plan that is tailored to your individual needs. Remember, you do not have to suffer in silence. There is safe and effective help available that can make a world of difference to your well-being during menopause and for many years to come.